All right, guys, we're going to jump into just the deep dive of Medicare Part A, Part B, Part C, Part D, and Medicare supplements. And the first thing I want to be able to walk you guys through is who is eligible for Medicare. You know, a lot of times we've gotten calls over the years that people are just confused on, you know, somebody in their family is eligible and they may be in their 40s and saying, you know, how do I get on Medicare because they don't pay anything, and or how do I get insurance like my parents have? And you know, honestly, when I got into the business, I was very confused on exactly what Medicare was. I grew up in a home where my parents didn't sit down and walk through their personal family matters, dealing with their family, my grandparents or aunts and uncles, people that were on Medicare and Social Security. I didn't know what any of that really meant until I was later, you know, I was married and older when I started understanding that people got paid a Social Security check, and then that people could qualify for health insurance at a certain age. So I was always under the assumption that people had to work for an employer, retire with a retirement income and a retirement health insurance plan, or they wouldn't have health insurance. So I was just like you, maybe very confused about how Medicare worked. And so I'm going to walk you through who's eligible and then walk through the different parts of Medicare with you and make this very simple for you. But it's kind of a level playing field for all of us. Myself, when I got into this business and started learning and educating, and then over the years as I began to educate others and really do things like this just to educate the general population on how Medicare works, it allows you to be able to come to a common knowledge of knowing how did you arrive at this point to qualify for Medicare. So who's eligible? Anybody that's worked 10 years or 40 quarters or longer is going to qualify for Medicare Part A and or Part B. So Part A is basically paid in full. So through your FICA taxes, so anybody that's had an employer that's ever did a W-2, or if you're self-employed, like I'm self-employed, but I've paid in FICA taxes. FICA is basically goes towards Social Security and it goes towards Medicare. So if you've worked 10 years or 40 quarters or longer, it allows you to qualify for Part A. So Part A is an entitlement that is a check off once you get 10 years or 40 quarters worked and you paid FICA taxes in for that amount of time. Your Part A is paid in full. It doesn't cost you anything to go on Part A. Most people that are turning 65, automatically they enroll. Your Part A goes into effect on your 65th birthday month on the first day of that month. Okay, so Part A is kind of pretty easy to understand. Your Part B, most of you guys are going to have a Part B premium. So the Medicare Part B premium, you're entitled to Part B by working and qualifying through the benefit factor of being 65 or older, or qualifying for Medicare disability. So you can be under the age of 65, have worked 10 years or longer, or if you have a child with certain mental issues or certain eligibility requirements, that child can draw from a spouse. They can draw from a spouse, but also a child can draw from a parent, or basically like a person that's paid in or qualifies for Medicare Part A and Part B, or Social Security. The child can actually qualify through the state through programs, but also sometimes that child can draw from a parent's Medicare and be eligible for Social Security disability, and then go on to Medicare after the 25th month. That we're not going to go into because it's a lot of moving parts to that, and if your situation calls for that, I would say call us so we can provide you some information, some forms, and then the route that you need to go to see if your child qualifies for that. But for people that are under 65 years of age that have maybe been injured at work and are not able to work, they can qualify for Social Security disability. Typically they have to get an attorney and go through the process, go before a judge, and the judge deems them disabled. When that happens, at the 25th month, they go on Medicare Part A and Part B automatically. Everyone else typically is 65 and older. And then as I age into the age of 65, I actually don't qualify to go on Medicare Part A and Part B until I'm 67, or I can opt to wait until like 70 years of age. So they're actually moving that date up for people to qualify for Social Security and for Medicare Part A and Part B. But for you guys that we're serving right now, it's 65 years of age typically that you qualify for Part B. Well, Part B has a premium. That premium can change every year. Right now it's $148.50, and it typically goes up by by what they call cost of living adjustment, or COLA. So cost of living adjustment, or COLA, C-O-L-A. And there's always an adjustment each year for the Part B premium normally, just like there's an adjustment for your Social Security increase. A lot of seniors tell us my Social Security went up by 3%, but my Medicare Part B premium also went up and basically consumed my increase in my Social Security is just paying for my Part B. So it's always funny what people will say when they're looking at how they balance their budget and things like that. But Medicare Part B is something you pay, and then having Part A and Part B makes you eligible to be able to enroll into healthcare plans that we're going to cover here shortly, like Medicare Advantage, prescription drug plans, or Medicare supplements. And again, if you're someone that is under the age of 65, or you have a dependent child, or someone that's mentally handicapped and you're trying to figure out the options for them, I would say call us, or if you're researching online, make sure the research is valid, but give us a call. We can provide you direction on how to get in touch with Social Security, Medicare, and see if they qualify for Medicare Part A and Part B, or if they're already entitled to Part A and Part B and you're just misunderstanding what they do, what they're already qualified for, and how to engage and get them into better health plan options for their needs. Now, Part A. So what is Part A? Part A of Medicare is hospitalization, or if you're looking at a red, white, and blue card, a Medicare card, you'll see that it shows Part A at the top. Well, basically at the top, it's going to say Medicare beneficiary. It's going to have your Medicare claim number. Below that is going to be like a line, and it's going to say Part A and Part B. So Part A is hospital. So Part A, original Part A of Medicare, when you become eligible or entitled to Part A, that's going to cover the hospitalization part, minus you're going to always be responsible for a Part A deductible. Now, the Part A deductible right now is around almost $1,500 per entrance into the hospital. So if you go into the hospital and you stay day 1 through 5, you're going to pay a Part A deductible. It's going to be relatively about $1,500, or if you're looking at this a few years from now, it may be $1,600. So that Part A amount is controlled really by CMS or Medicare. The government controls the Part A and Part B deductibles, the amounts that they are. So Part A deductible right now is around $1,500. If you go in the hospital, you stay 3 days, you come out. If you consistently stay out of the hospital for consecutive days of 60 days or longer, and then all of a sudden something happens and you're readmitted to the hospital, say day 90, well, guess what? You have to pay, after 60 consecutive days of being out of the hospital, you have to pay that Part A deductible again. Now, if you go in the hospital and have a reoccurrence within the first week and you go back in, within those 60 days, you don't have to pay that Part A deductible. The Part B that we're going to cover in just a moment, you're going to have some co-insurance and deductibles and cost, but the Part A deductible is pretty simple to understand. You're going to have the amount that's prescribed by the year that you're in. So if it's year 2030 and the Part A deductible is $2,000, that's what the deductible is, and you're responsible for that deductible if you go into the hospital just being on original Medicare Part A and Part B. So I always say there's a big question mark that we put out beside original Medicare. Original Medicare, as I like to say, is better than a punch in the mouth, but there's extremely high cost and volatility to most Medicare beneficiaries that just stay on original Medicare and do not choose to enroll into any type of health plan. It's going to put you at a higher risk of out-of-pocket cost. Part A is the first step into that. Part A also has these days called lifetime reserve days. So if someone goes into the hospital and stays day 1 through 60, let's say they go in, my father passed away 2 years ago, it will be 3 years this December. He was in the hospital for 3 weeks. So to give an example of lifetime reserve days, or what happens in the hospital, you basically have day 1 through 60 that a person can go into the hospital and stay consecutively, that beyond day 60, if they stay day 61 through 90 or up to 150 days, Medicare gives them 60 days of lifetime reserve days. So that just means consistent or consecutively, if somebody goes in the hospital and stays beyond 60 days, they begin to eat into the 60 days of lifetime reserve days. If they eat into those days, basically what happens is they have, up from 91 days to 150 days. So 60 days to 90 days, they're going to pay a cost per day. And then from 91 to 150 days, they're going to pay a higher cost per day. But from 91 days and beyond, they're going to get into their lifetime reserve days. There's 60 of those days. Now, obviously, most people don't stay in the hospital beyond 60 days, typically not beyond 5 or 6, 7 days. Most of the time, if you're doing a surgery, you're in and out in a couple of days. But if somebody goes in like Christopher Reeves and is admitted to the hospital and stays a consistent year because they're in trauma, ICU, in a coma, and they're just there as a vegetable, but they're still alive, they have brain activity, whatever it may be, somebody may not have a do not resuscitate or DNR on file, and that all of a sudden this person is in there for months. They're going to use up their lifetime reserve days, or their days that Medicare will cover, up to 150. So 150 days and beyond, consistently, if somebody stays that long, you're going to end up having the cost of the hospitalization owed to that person at 100%. So whatever the cost per day to stay in the hospital, all of a sudden they assume the responsibility of that cost. Medicare stops paying. So that's very important to know about your Part A services. So what does the coverages include when it comes to hospitalization? There's typically about 7 main items, but the hospital stay itself, the hospital bed, like the nurse, skilled nursing facility. So if you're going into a hospital having a surgery and have to be released to a skilled nursing facility, that falls under Part A. And to understand skilled nursing facility, it basically covers up to 100 days. Typically the first so many days with original Medicare are just covered at no cost. With Medicare Advantage plans, you guys will find out that typically day 1 through 20, there's no cost for skilled nursing rehab. So skilled nursing facilities are set up for rehab if certain daily living functions, ADLs, are not able to be obtained, or that person can't walk or take care of themselves. They may transfer them into a skilled nursing facility. My dad basically passed away being released from the hospital. He had COPD and emphysema and ended up getting pneumonia and getting admitted to the hospital. And through that process, three weeks later, he kept on going septic, but they released him into a skilled nursing rehab to try to get him back on his feet within the first night. His oxygen O2 stats went down into the 60s, and they transferred him to the ER, where he stayed until he passed away just shortly after being there. So, but my point in saying that, had he been admitted to the skilled rehab and rehab for maybe 3 to 5 days to regain his strength, then they would have released him to the home. And then, in this condition too, a lot of times people that are in the hospital, we just had this happen with somebody that's here in Clarksville, Tennessee, that they've been in the hospital. The guy's 80 years old and he's having major heart failure. Well, he's to the age where he's like, I'm not having major heart surgery. There's too much of a risk. And so now they're calling in the family. Typically when they call you and say, hey, we have a family member here, we're just calling you guys to let you know they're at end of life. Sometimes that person is released into hospice care. Hospice falls under Part A. Hospice does not cost anything. So if that person's terminally ill, is going to die in projection of 6 months or less, they're going to turn them over to a hospice care provider. And then the same thing with a Medicare Advantage plan. If you're enrolling into a Medicare Advantage plan, like a HMO or PPO plan, and you are provided basically a hospice care that falls back under original Medicare. Original Medicare prescribes or provides a hospice care provider that's contracted with Medicare to provide your care at no cost. And then also, typically, guys, like I said earlier, you're going to be automatically enrolled into Medicare Part A at the age of 65. If you do have questions about your enrollment, you can call us. There's a couple of different forms that you can actually go onto the Social Security website at ssa.gov and have access to that. We also have that on our website. We also can just email you the forms, walk you through the forms. If you're trying to enroll for Part A and Part B and you're on an employer plan, or you've turned down your Part A and Part B and you're trying to fix that, there's all types of different situations that seniors will get themselves into turning 65. I would inquire or ask that you guys get with someone like us so we can walk you through the steps or watch some of our videos explaining those steps. But it's easier just to call and say, hey, it may be 2 years from now that you're coming off an employer plan, and the steps should be the same, but they can change. And we just keep up on top of that information, the forms and documentation, and the steps that you need to be able to take to do that. But you typically automatically enroll into Part A when you turn 65. Most people don't have a Part A premium, again, if you've paid FICA taxes in. But I will say this, if you did not pay FICA taxes in, Medicare Part A does have a premium associated with it. So you can actually enroll into Part A and still qualify to have Part A services. But if you have not paid FICA taxes in, you have to pay several $100s a month to qualify for Part A. Again, there's an asterisk beside that. So if you are that person that has not paid 10 years or 40 quarters or longer, and you have questions about your Part A, get with a educated advisor like us or a brokerage firm like us to walk you through answering maybe some difficult questions on what your options are. If you're fixed and low income, you may qualify for state Medicaid, not need to pay that premium or can't pay that premium. Your situation, it just reflects your income and a lot of different moving parts there. If you're self-employed and did not pay taxes for years, regardless of the amount of money, you're not going to qualify for Part A because you didn't pay FICA taxes in. We run into this situation in rural communities where someone is maybe a painter, somebody, they always were paid cash for their jobs. They were just simple in how they did business and they didn't pay in taxes. And you're going, what do I do if I'm in that situation? You need to be able to call and we can walk you through what your options are as far as health coverage beyond the age of 65. So again, Part A is your deductible that you're responsible with. Medicare covers everything above and beyond that deductible in a hospitalization stay. And again, I went over a few of the main items that fall under Part A. Those are the main ones that most people are concerned with. There are some other moving parts to Part A that we won't deep dive into right now. If you do have questions about other things about Part A, give us a call. So let's go into Medicare Part B. Medicare Part B is often called, it's just part of original Medicare Part A and Part B. So Part B is going to be called the medical portion. So Part A is hospital. It's dealing with attachment to things that are done with the hospital or coming out of the hospital like skilled rehab or hospice care. Part B is medical. So that's everything done outside of a hospital. So your primary care doctor visits, your specialist, diagnostics, preventative is a huge one now that Medicare used to not cover all preventative services, or they had an allotment for, a mammogram every so many months or colorectal screenings, even longer period of time, depending on your risk level. Now Medicare is basically created more preventative care services that they cover. Medicare Advantage plans for several years have covered additional preventative services like disease screenings for like diabetic, cardiovascular. Like if you're at a high risk for certain diseases, they've always covered those preventative screenings a little bit more in detail than original Medicare. But now original Medicare is providing a lot more preventative services under Part B. So that's a good thing to some degree, but the problem with that again is Medicare Part B is going to have a deductible each year. It's a smaller deductible. Right now it's around $200. And then you're going to be responsible for the billable rate of 20% of what Medicare does not cover. So Medicare is ran and operated by what they call a fee schedule or fee for service schedule. So if you go to the doctor, original Medicare has an allocated amount, a contracted amount that doctor is contracted with Medicare. They're going to pay them a dollar amount. You're responsible for 20% of that. Medicare covers 80% of that. So let's say it's $100. You would pay $20. Let's say if it's $300 for a specialist, you would pay $60, and the Medicare picks up the remaining amount once you've met your Medicare Part B deductible. So you have to factor in the deductible, and then Part B, 20%, and that's going to be for any and everything outside of a hospital, which typically, there's normally about 28 total items that fall under Part A and Part B services. 7 of those really kind of fall under Part A. The other 21 fall under Part B services. And I'm going to go over a couple of those here in just a moment with you, just a list. But also, original Medicare, they have a fee schedule that doctors are able to charge, but the doctors can also charge what they call an excise charge above that fee schedule up to 15%. So that means that doctor can choose to charge an additional amount above that $100 example for a primary care doctor. And that's just an example. I'm not saying it's $100 when you go to your primary care doctor, but let's say if it is, just for the simple math, $100 plus 15% would be $115. Then you'd pay the deductible first, which would be $203 right now. So the first visit, you would have to pay $115. And then your next visit, if it was $115, you would subtract out the balance and then pay the 20%. Then the next visit, if you go to the primary care doctor, would be $100. And if your doctor charged the excess charge of 15% or $15, it'd be $115 times 20%. So see, it can get kind of complicated on how that works, but just know you're paying the deductible of what Medicare Part B deductible is for that year. You're paying 20% of the cost, and the doctor can charge you up to 15% more of what Medicare's fee for service amount is. So that's dealing with an MRI. If an MRI is $4,000, 20% of that is going to be $800 that you are charged. It can get very costly because if you go to the hospital and you have a surgeon outside of the hospital come in and they have to bill under Medicare Part B services, guess what? You're going to pay the hospital deductible and cost, and then you're going to pay the Part B cost. We have seen people go into the hospital that were on original Medicare, come out after 2 weeks staying in the hospital and having massive heart surgeries and things like that, and all types of complications that can occur to people when they're older, and come out owing over $100,000 for Part A and Part B for their portion. Medicare Part B, we like to say, or Medicare A and B, is better than a punch in the mouth. But one of the reasons we educate you guys on the different options is you need to choose a health plan option that's going to cover the majority, if not all, of that cost that Medicare Part A and Part B exposes you to. So Medicare Part A, again, deductible. Part B, deductible, co-insurance. And then we always like to say this big, huge question mark, because you never really know exactly what you're going to pay until you've gone through the process. They've billed you and sent you the bill for 20%, and then you get a nosebleed because somebody's punched you in the mouth or in the nose 10 times with the bill, and you're like, I never knew that it would cost this much to have that done. You need to insure yourself to eliminate that risk that Medicare Part A and Part B can put you at. So what are coverages that Part B can include? Medical services like your primary care specialist, diagnostics, ER, lab, and x-rays are going to fall under Part B. Outpatient care, like an outpatient, the ER visit or a walk-in clinic, that type of thing is going to be covered. Medical items like durable medical equipment, prosthetic devices, those are going to fall underneath Part B as well. Therapies, if you have physical, occupational, speech, language therapy, that's going to fall underneath there. Intermediate skilled nursing aid, home health services in the home, that's going to fall under Part A, Part B, not to confuse you, but depending on what type of care they're providing. Medicare Part B drugs or Part B chemotherapy drugs. Now, if you're diagnosed with cancer and you have to get chemotherapy treatments, guess what? Chemotherapy treatments are extremely expensive. You're going to pay 20% of that chemotherapy cost. So it could be a $4,000 shot that you're getting or injection that you're getting each time you go in for chemotherapy. You're going to pay 20% of that, which would be $800. So it's very easy for somebody going through radiation and chemo with chemo Part B or Part B chemotherapy drugs to hit an extreme high dollar amount that they owe on original Medicare. Again, original Medicare is what I say better than a punch in the mouth, but because of the cost that it can expose you to, all of a sudden you realize, okay, there's this huge question mark that Kelby pointed out. I never took the steps to enroll into a health plan to cover those costs. Now I'm figuring out what this question mark is all about, because there's extremely high cost to Medicare Part A and Part B services at times, dealing with certain diagnoses and treatments and things that people experience. If they choose to stay on original Medicare, that's your choice. My encouragement is to always use Medicare Part A and Part B as a key that unlocks the door into your opportunity to enroll into a health plan that a lot of times allows you to cover your cost, deductibles, the co-insurance, and we're going to dive into in just a moment Medicare Advantage. So I'm going to explain how it covers those costs with Medicare Advantage, and it lowers or eliminates the risk that you can be exposed to by the unknowns of original Medicare. Again, guys, if you get to this point and you just have, you're like, hey, I've watched enough that I realize that I don't want to get into the weeds with this. I want to be, I want you to be able to just take my medication, my doctors, do a plan review and make this very simple. I would say pick up the phone, call the number below, give us a call, have that information gathered if you can. We'll take that information, we're going to put it into our platform. Within a few seconds, we're going to be able to give you a comprehensive review and then guide you toward the plan that's going to meet your specific need. Every person's needs different. We're here to be able to help make your life easy by making Medicare simple and rolling you into the plan that's the best fit for you. Guys, we're going to take a break for a second and then we're going to dive into Medicare Advantage plans and what that's all about as well. Talk to you soon.